Wonderful. And how are you doing today?
I am doing well. That laughter should tell you that.
Right. And good morning to our entire listening audience on the worldwide internet and both locally. For those of you who are local, I'm coming out of the 970 AM out of Ahoskie, and I'm actually in one of my nursing homes down east coming to you live. And for those of you on the internet, those of you who want to catch us on the internet that are local, you can go to Ask Dr. Ferguson, AskDrFerguson.com. Right on the center page, there's a link that says Live Radio. Click on that. That will take you to my YouTube site, at which time there's a little house in the upper left-hand corner. Click on the house, and then click on Feed. And you'll be able to catch the program live. There's about a 30-second delay, so I wouldn't try to do the radio and the program at the same time.
Right.
And for those of you who want to catch some of the previous programs, we started doing this a few months back, so all of the programs we've done in the recent past should be archived right there on that website. So that's a way that you can join us live, both visual and hearing us. We've been talking the last several weeks about vitamins and minerals, and we've kind of touched the surface on that, but there's probably a lot more that we can still talk of in that regard, because having a better understanding of vitamins and minerals is a very critical thing, I think, because you'll hear so much stuff on the news, so many things, and when you go to the store, you'll see 50 at least different vitamins or minerals that you could partake of. So having a better understanding of what you're trying to partake of, I think, is important.
And I would agree. It's very important.
Mm-hmm.
We don't want to get something that's really not being beneficial to them. But
Exactly.
at the same time, as you have said many times before, especially if someone's on other prescribed medications, they should check with their physician.
Always check with your physician. I think that's a good first step. And if your physician is not much into natural things and holistic things, and you might want to check with somebody else, but I think it's definitely a good first step to check with your physician, for sure. So just a brief summary again, then we'll go into some new stuff. When you talk about vitamins and minerals, vitamins are, you have the water-soluble vitamins, which are your B's and your C's, vitamin C, and then you have several vitamin B's. And then when you talk about the fat-soluble vitamins, the most common ones there are A, D, E, and K. And just as a quick side note, if you're going to get A, it's probably best to get it as beta-carotene, because it's much less likely to become toxic, because the beta-carotene will get converted into A. Now, when you're talking about vitamins, the water-soluble vitamins, they're going to pass out in your urine, so they're not going to be confined, the urine, your stool, so they're not going to be confined to your body and just stay there forever. Whereas the fat-soluble vitamins, they can get absorbed into the fat, and when they get absorbed into the fat, that could be a problem. So you do have to be careful with the fat-soluble vitamins. They can become toxic if you're taking too many and too much. So that is definitely an area where you just can't take all that you want. Vitamin C and B, it's hard to take too much, but you could do that too. But the fat-soluble, you have to be careful because they absorb into your fat, and your fat obviously is not going anywhere anytime soon. And so what happens is if you get a surplus of vitamins that are stored into your fats, well, now that may cause some abnormalities in your body. And then we talk about the next thing when we talked about vitamins, we talked about our vitamins being organic and minerals being non-organic. And that's suggesting that we can't produce or can't make them. So when you say the word organic, that suggests living. When you say non-organic, it suggests non-living. So the minerals that we have in our body, they never change forms. They don't change at all. So the same way those minerals are when they come in your body are the same way they are when they leave your body. So no new minerals on Earth, and they come in and they do what they have to do. They help in enzymatic reactions. They help as catalysts. They help join with vitamins sometimes to get a reaction. The vitamins and minerals, neither one of them would be considered nutrients, but they help us in the absorption of our food. They help us in the utilization of the food that we're eating.
And they will always be there.
And they'll be there if you take them in. You can become deficient in both vitamins and minerals.
Okay.
But the key here is that The vitamins are referred to as essential nutrients that you have to take them into your body. Some of your minerals are kind of there in your body and kind of hanging out because your bones, things like that, are high in minerals. Your teeth are high in minerals. Your hair. So there's lots. Your muscles, your nervous system. So there's a lot of places in your body where you have minerals. But when they do leave your body, they leave just like they came in. Now, how do the vitamins and minerals get into your body? Via mostly your fruits and your vegetables, but some via your meats. Because the plant, it grows in the soil, it takes up the vitamins and minerals while it's growing, and you eat the plant, you get the vitamins and minerals. From the animal point of view, if the animal is eating the plants and the vegetables, well, now it will get some of those vitamins and minerals into its system. And then when it's made into meat for consumption, then you'll get some of those vitamins and minerals that were in that animal.
Okay.
But for the most part, you're going to get most of your vitamins and minerals from your fruits and your vegetables. And that having been said, you have to understand that you may be deficient in some of those vitamins and minerals because the soil by which those fruits and vegetables were grown may be depleted of something. Maybe they've been growing, maybe it's an apple orchard. They've been growing apples there for 200 years. So maybe it's depleted. Maybe it's just a regular farm and they've been growing, maybe they're even rotating crops. Maybe 1 year corn, maybe 1 year soybean, another year cotton, peanuts. And the different products will take up different amounts of vitamins and minerals from the soil. But so even if rotating, you could easily become deficient in vitamins and minerals. So my mantra is that regardless of how good your diet is, you still need vitamins and minerals. And back along that same line, the Mediterranean diet is a great way to eat, at which time you're going to get your vitamins, your minerals, and lots of antioxidants, things that help fight off cancer. So that's a good way to try to get some of the things in that you need, but I still suggest a supplement.
Okay.
Now, when you talk about vitamins and mineral supplements, which one is the best one? Well, I can't tell you which one's the best one, but I can try to educate you on some of the things you want to look for. When you look at our different vitamins and minerals, it'll say on the label the recommended daily allowance. Well, the recommended daily allowance is often not enough for you to function at your best. It might be enough to keep you from getting a disease that we presently know of, such as scurvy with vitamin C. It only takes 65 milligrams a day not to get scurvy. Well, I recommend 2,000 milligrams a day. So many times there's a big difference in the amount that meets the recommended daily allowance and the amount that I would recommend you take in. And understand the daily recommended allowance were not established on a general population. They were established with a cohort largely of white males in their 20s. So that doesn't exactly describe the majority of people in the population. And so these numbers that they identified coming up with the recommended daily allowance may be far from what you personally may need. So it's a reasonable guide, it's a reasonable starting point to know what they're suggesting as a daily recommended number. But by no means should you fix in on that and suggest that that's the amount you need and that's the amount that's going to be enough. I mean, if you get that amount, you probably are doing okay, but you're probably going to need to exceed it in most cases. Okay. When you talk about vitamins and minerals, that's a big, wide audience of products, and understand that when you're in the natural category, vitamins, minerals, herbs, things like that, homeopathic, those things don't have a regulation on them like the FDA does for prescription drugs. So what am I saying? I'm saying that you can go in your kitchen right now and put some mustard in a jar and mix it with ketchup and sell it for a hair tonic. And until enough people complain that it doesn't really do what you said it's going to do, then nobody's going to check you out. When enough people complain, then the FDA will send out a team to check you out and maybe tell you to cease of what you're selling or the description that you're giving it. But because there's no regulatory body that evaluates natural things, you have to be very cautious on what you take in and what you get into your system. So you find somebody that you agree with what they say, that you trust what they're saying. Maybe your own physician, maybe your healthcare provider. There's a few good doctor programs on TV. Dr. Oz usually does a pretty good job, although I don't watch it that often. I think the Doctor Show, I think they do a pretty good job. But again, anything that I say or even anybody else says, you need to evaluate it, assess it, and see how it fits into your lifestyle.
And don't take it at face value.
And don't take it at face value, because there may be some differences. When you talk about natural things, a lot of times it's anecdotal, meaning it's kind of somebody's opinion, and not a lot of research on what's there. I mean, the same thing would go with any aspect in life. If you're in a sermon and the preacher's saying something you disagree with, well, check it out in the Bible. See if it's right, if it's not right. If it's right, then say, okay, I was wrong. If the preacher was wrong, then just don't take that part in. So it's important that you have a healthy skepticism, that you're going to check out and evaluate things when somebody tells you something. And particularly in the natural realm, because there's so much false advertisement, so many things that just aren't correct. It may be peanut butter. The peanut butter may say on it cholesterol free. Well, so everybody hears about cholesterol, so they say, oh, that peanut butter must be a good one. Well, peanut butter never had cholesterol in it. That was just an advertising ploy. Cholesterol comes from animal products. So if it's not an animal product, it doesn't have cholesterol in it.
Okay.
So those kind of things can be very misleading. And the labels, the American, a lot of people will sell their labels. I don't know who sells them and who doesn't, but you might see a label that says American Dietary Society, American Cardiology Society, American something. And they may have a label on that particular product. Well, it may or may not have met some specific specifications, or they may have just bought the label. So just be a little, be cautious in when you start to partake of something new and different. You see something advertised on TV and it sounds too good to be true, it probably is.
Probably is.
So just be cautious in those realms. You see a new product hit the market and it says you're going to lose 20 pounds in 20 days. Not realistic, okay? Realistically, a pound a week, 5 pounds a month, 30 pounds a year, 60 pounds a year would be a decent and good weight loss that one can sustain. So when anything is much faster than that, you really need to put on your antennas of skepticism and see how successful this is going to be. There are no quick fixes with weight loss and weight management. It just doesn't happen. You can't go to the gym and lift weights for 3 days and think you're going to look like Mr. America.
I know that's right.
It's not going to happen. And so anything worthwhile is going to take some time, energy, and effort, and understand that that's part of life. If you're going to have success in something, it's going to take time, energy, and effort. Again, those of you who are joining us live on the radio, you can always catch us on the YouTube as well. Go to AskDrFerguson.com, middle of my page, click on Live Radio. When you get to the YouTube site, there's a little house in the top left-hand corner. Click on that, and then you'll be able to catch the program live when you push feed. You'll be able to hear and see what we're doing live. And we do archive the programs too, so you can always go back to youtube.com/user/AskDrFerguson. You'll be right on my site. You'll be able to catch all the programs we've done in the past. And for those of you who have trouble remembering all of what I just said, if you go to the Google search window and you just type in Ask Dr. Ferguson, AskDrFerguson, you'll come up with multiple pages that have some of my stuff on it. Maybe mixed in with some other people's stuff, but you'll find my stuff as well. Or if you type in Stephen Ferguson in the Google search window, Stephen Ferguson MD in the Google search window, Stephen Ferguson MD, CMD, all of those will take you to websites that have material that I have out there. And so that's a way a lot of my substance abuse patients find me via the website. They find me, they plug in Suboxone Doctor, or they plug in Substance Abuse Doctor, and they find me via the website. So that's another method by way people can find me. And some of you may not be so computer savvy and you want to interact with me. You can always call my office, 252-332-6484, and you can ask for a topic that you want me to talk about on the air. You can get an appointment to come in and see us. All of those things, the sky's the limit. We do a lot of preventive health in the office. We do a lot of weight management, natural hormone therapy. We do a lot with Alzheimer's disease, and do a lot with just family medicine in general. So we do welcome new patients, and those of you who are enjoying the program and think that you don't need to see a healthcare provider because we give you a lot of information here, not so. Not so. You still need to see your healthcare provider. Every now and then I'll get patients in the office that haven't seen me in years, and they'll say, well, I listen to your radio program every week. I didn't think I need to come to the doctor. Not so. Not so. Preventive health is the key. And I tell people all the time, it's much easier to prevent your hypertension than to treat your hypertension.
And that it is.
It's much easier to prevent your diabetes than to treat diabetes. It's much easier to prevent obesity than to treat obesity. So treatment is much easier than, prevention is much easier than treating. So for those of you who have the attitude, well, if I get it, I get it. If I don't, I don't. Well, it's a bad attitude because prevention is much easier than treatment. So that's a kind of a summary, and kind of went down a couple other paths there today. But let's come back to this vitamin and mineral issue. So we got vitamins and minerals. They're used in your body for all types of different things. But let's just run through a list here. And I'm going to start out with vitamin A. One of the ways you want to get vitamin A would be retinol. So that would be one of the common products that you can find on the market that has vitamin A. And vitamin A is useful for your eyes, your mucous membranes, the formation of those mucous membranes, your bones, as well as your teeth growth. So vitamin A has a lot of different places where it can be very useful. And again, if you're going to go after the vitamin A, I would suggest you do the beta-carotene as opposed to the vitamin A. Now, what it's recommended is a recommended daily allowance, and again, these are just basics. These are probably, I would suggest, are maybe the minimum amount of these different things that you should take in. So the recommended daily allowance of vitamin A would be 500 international units, or 1 milligram. So when you go to look at your vitamins and minerals, you want to see how much it has in it. And beta-carotene, again, will be the better way to get your vitamin A in if you're just going to do it as an individual product. So then we have lots of Bs. B1 is thiamine. And thiamine helps in your energy metabolism, and it helps with your nervous system. So if your B1 is deficient, you may have some challenges with your nervous system and how well you utilize the food in which you eat. The daily recommended allowance for that is 1.5 milligrams. Riboflavin, B2, that also helps in energy metabolism and helps the tissue of your eyes maintain their health. So that's another one for the eyes. And 1.7 milligrams is the daily recommended allowance for that one. B3, niacin. A lot of people have heard of niacin. Niacin, if you don't want to get the niacin, you want to get the anti-flush niacin. A lot of times we use niacin to help with your cholesterol profile and helping to increase your HDL, decrease your LDL. It has some benefit there. It helps with energy metabolism, helps with your skin, helps with your nervous system, as well as your digestive tract. Most of the time I'm using it as an individual product, I'm using it to help with the cholesterol profile. And what I'll have a person do is I'll have them start out with 500 a day and move up to 1,000, 1,500, 2,000. Every now and then we can make it up to 3,000, but a person often begins to have flushing, kind of like the sweats that a person would have when they're having hot flashes at night. They'll have flushing that lasts about 20 minutes. That's why you want to try the anti-flush ones. But again, that's one of the normal things that happens with niacin. So I don't even know if I want to call it a side effect. It's one of the normal things that happens with niacin. It happens about 20 minutes and then it goes away. There are some ways you can get around that, but just discuss that with your healthcare provider. B5, another one of your B vitamins. That's key in metabolism of carbohydrates and fats and proteins, and it's involved in making some of the chemicals that help transfer information from one nerve to another nerve. You have B6, that helps in the amino acids as well as the fatty acid metabolism. So fatty acids is one of the breakdown products when you're getting your nutrients in it. You have fats, proteins, carbohydrates, and you have a lot of things going on in your body to help you break those down to small enough compounds by which you can use them. So when you eat meat, it's going to be in the form of protein, but that protein has to be broken down further into what we call amino acids so that you can then utilize it. And we talk about fatty acids, that's again a level at which your body can begin to utilize those things for energy, building your cells, etc. B7. B7 is another one of your B vitamins. That's biotin. A lot of people may have heard of that. Helps it, again, most of your B vitamins are going to help some with energy metabolism. So that helps with energy metabolism, helps with your hair growth, helps with your skin and your muscles. B9, a lot of people have heard of that one. That one's folic acid. Folic acid, very important in the development of the baby while it's still in their mother. It helps with the nervous system development. many cells. It also helps in the reproductive system of growth. So they recommend 400 micrograms of that on a daily basis. A lot of times if a person is deficient, I'll usually give them a milligram of that a day, which is 1,000 micrograms. B12, a lot of people heard of that. People say, I'm tired, I'm run down, I need a B12 shot. So that's a common thing you hear people say. That helps with cell synthesis. It helps with your nervous maintenance. You have your nerves, you have your muscles, you have your bones. All of those systems have to be working in harmony in your body. If they're not working in harmony, then you're going to be out of balance. And so there's so many factors that go into this, and these are just some of the factors. Okay, so next we have vitamin C. Vitamin C helps with the collagen formation. It helps with amino acid metabolism. It helps enhance absorption of iron. It's a great antioxidant, and we've talked about that many times in the past. When a cell starts to function abnormally in your body, it's often called a free radical. Think about somebody, doing things their own way. You say that person is just a free radical. That's a radical person. They're just free and radical. And so when a cell starts developing and dividing abnormally, we call that a free radical. And what it largely means from a chemical point of view is there's a chemical imbalance in that cell. And what antioxidants do is they come into your body and they help bring balance back to that free radical. And as they bring balance back to that free radical, now that cell can function back in the normal category. Because what happens is cancers, infections, they all start with an abnormal group of cells not working right. So if you're going to get a cancer, it starts by a group of cells not working right. And 5 to 8.5 years later, you have something that now you can detect via lab work, via CAT scan, via clinical exam. But it takes a long time before you can detect the cancer, even the fast-growing cancer. So what's the message behind that? Get your regular checkup, do your preventive health care. Even if you're doing those things, could you still come down with something? Yeah. But again, if you're going to come down with something, maybe we catch it earlier. The big difference in catching a tumor mass when it's still a stage 1 as opposed to stage 4. Big difference in catching something very early. Sometimes we can operate on it early. If it's late, we can't operate on it. So again, having your regular yearly checkups becomes a very important component to catching things early. Vitamin D. A lot of people heard of vitamin D. Oftentimes we're using D3. That helps bone mineralization, helps the bones. Your bones are constantly growing. At all times, your bones are building and breaking down, building and breaking down. It's kind of like you're building a house. You put a few blocks in, you take a block off. You put a few blocks in, you take a block off. And that's what we call remodeling. So, and when the bones, if you look at one of the bones in your finger, and you look at that bone, you say, well, that bone's been there a long time. But it has been there a long time, but not your whole life. Your bones will transfer over. It takes about 8 to 10 years for the bone to become a new bone. And how does that work? Very slowly, part of it's being eaten away, and part of it's being built up. Eaten away and build up. They call it osteoblast and osteoclast. The osteoclasts are eating up the bones. The osteoblasts are helping build new bones. And there's lots of different chemical reactions and things that take place in your body that are going to help that process work better or not work as good. The osteoclast is stimulated by estrogen. So the younger women often don't have a problem with the eating away of bone. The osteoblasts are stimulated by testosterone and progesterone. So a young, healthy person that's got their hormones in balance, they're probably making and building bone the way they should. But as a person gets older, oftentimes they have an imbalance in their hormones. What happens? Now you may not be making and building bone as you should, and you may end up coming up what we call osteoporosis, osteopenia, osteomalacia. So there's lots of different descriptions that your bones aren't healthy as you think they should be.
Oh, okay.
And so that's where, having the right amount of vitamins and minerals in your body can be very helpful. But did that make sense?
Yes, because before you answered the question, I was about to ask about osteoporosis, but you answered it.
Mm-hmm. Right. If your bones aren't getting the right nutrients over time, if they're not building and making in harmony, then eventually they're going to get weak and brittle and be willing and easily broken. But the body is so wonderfully made that at the same time some of the cells, some of the osteoclasts are eating up some of the old bone, osteoblasts are laying down new bone. So consequently, it's an ongoing, continuous cycle, 24 hours a day, 7 days a week, for a lifetime. Your bones are going to be new bones. You're going to have a whole different bone. Like when you break a bone, your body many times heals that by putting a bridge over the area that's broken. So if you think about, if you draw a picture, put 2 lines on paper, and then put a break in the line and put 2 more lines. A lot of times when your bones are healing, they heal by putting like a half moon, on each side of those lines you just drew, and that's how the bone will begin to bridge that gap when you have a broken bone. And then what happens is remodeling takes place, and then the osteoblasts and osteoclasts will have new and different work to do, and so they will eat away that bridge part. So when you look at that bone on an X-ray sometime later, maybe you might not even be able to tell it was broken. You know, to the experienced eye, to the radiologist, they can still tell, but the bone will look very much like it used to look prior to it being broken.
The body is an amazing machine.
It's an amazing machine, and it's all working in harmony. And this is why it's important that we supplement those things that we know are deficient. I saw on the news yesterday they're thinking there may be a challenge now with all the fortification that's taking place of foods. Fortifying means most times when you bleach your food to make it appealing to the eye, so you take out nutrients when you bleach it. But after you put bleach on your jeans, you take out the color. But after you put bleach, when you bleach the food, you take out some of the nutrients. So what happens in a lot of food processing, they bleach the particular food, and then they fortify, meaning they add back what they think should have been there, or what they think they took out. So even as sharp as man is, and as wonderfully as we can do so many things, we can never do it as good as God made it in the first place.
Amen.
I can guarantee you that part. And we will never match what he did in the first place. And so because of that, as we try to replenish the different food groups or the nutrients that we're taking out, sometimes that can run into problems. And I didn't catch the whole program, but I saw just a brief blurb on the news that says fortified foods may be causing a problem with getting too much of certain types of compounds. And it would make sense that you could get too much of something. Makes perfectly good sense.
Yeah.
When you fortify something. For those of you who enjoy our program weekly, don't always forget you can catch us on. Don't forget you can catch us online at AskDrFerguson.com, and that's also my website where you can see some preventive health products, some links to other natural things that we talk about. Lots of preventive health care things there. But also on the middle of that front page, there's a link that will take you to the YouTube site, which is youtube.com. You can go there, you can click on a little house right in the top left-hand corner, then click on feed. You'll be able to catch the program live when we're doing it. And we have several of the recent programs, I don't know how far it goes back, maybe 2 or 3 months. Several of the recent programs that are archived right there that you can also catch and maybe fill in some of the gaps for some of the things you've missed along the way. You always can call the office at 252-332-6484. Always happy to see new patients. You can call and ask to talk to me about something you want me to talk about online. You can leave a message for some topic you want us to hit, or you can make an appointment to come by and see us. We're always happy to see new patients.
Okay.
So there are a few ways to reach me. You know, I really like, those of you who know me know I really like photography. And my photography site is photomedoc.com. So whenever I take photographs, I often put them on my website at photomedoc.com. Don't mention that a lot, but I just recently took a lot of shots that I really enjoyed taking, and able to share them with people by going to that site.
Okay, well, it's time for the elevator speech.
All right. Well, again, I know my wife is coming on later today, and I hear her program's getting great reviews. So I encourage all of you to listen to Talk Back Now with Patricia. She talks about political things and things that are happening that may affect your life on a daily basis. And she has her book, Poverty and Bookends, and what is it called? Poverty and Bookends. No, Poverty and Politics. So it's called Bookends, the name of the book, Poverty and Politics. So those of you who are interested in things like that, by all means, catch her program Monday, Wednesday, Friday. I think she comes on from 11 to 12 Mondays and Wednesdays, and she comes on, I think, 10 to 11 on Friday. Is that right, Bishop?
Yes, that's correct.
All right, so don't forget to catch her program as well as mine. And for all of you in our listening audience and the World Wide Web, I'm going to say have a blessed and wonderful day.
Bless you.
All right, bye-bye now.